In South Carolina, the state reporting 524 new confirmed cases. 7 more people have died from the disease. Percentage of those testing positive has now climbed to 17.9%. A stark warning from health leaders in South Carolina about the climbing case numbers. Their latest data shows the state could be on track for a fall surge, with an uptick already hitting the upstate. 7 News reporter Melanie Palmer tells us what health leaders say you need to do now to stop the spread.
Between what's being called COVID-19 fatigue and more people indoors, health leaders in South Carolina say they're concerned about the upward trend in cases, especially here in the upstate. Harriet Davis and Paige Harrison studying for this very subject.
It's definitely more applicable to have like a actual pandemic going on.
Health. More specifically, the number of COVID-19 cases South Carolina is seeing.
This brings the total number of confirmed cases to 172,216.
Doctors with the state health department are warning of a surge in the not-so-distant future. They're already seeing a spike in cases, especially in the upstate.
Cases, hospitalizations, deaths are all increasing across the country and internationally, and South Carolina is no exception.
Dr. Montagano has been watching these trends firsthand. He says while they have recently seen an increase of about 20 to 25%, there is a sliver of hope.
The people that we saw that were sick in March, April, and May were really sick. And now that we're seeing that we have a lot of high numbers and the severity of the illness has been down.
The reason behind the spike? Health leaders with DHEC say they're not entirely sure, but they do have some ideas, like what's called COVID-19 fatigue.
We don't have evidence that there's been some huge outbreak in, some business facility.
They tell us some people are wanting their normal lives back and are sick of following CDC guidelines. This Spartanburg man tells us he sees that fatigue on a daily basis.
I don't see how it's going to get better if nobody wants to do their part on it.
However, he says that's not the case for him, and he plans to keep his mask at hand. The main counties in the upstate that doctors with DHEC have their eyes on now with those uptick of cases: Pickens, Greenville, and they say surrounding areas. In Spartanburg, Melanie Palmer, 7 News.
Doctors say they're looking at data compiled since August that includes the number of hospitalizations from COVID-19 and the number of those patients who are on ventilators.